all. So I just wanted to make a quick little video tonight to talk to you a little bit about things that acupuncture can be beneficial in treating and why it's so effective in treating a myriad of different symptoms. So as a doctor of acupuncture and traditional Chinese medicine who works in a very Western setting, I get posed with this question all the time from physicians and from patients. And really, the curiosity is wondering how acupuncture can work for so many different things. And in that same context, what is it most effective in treating? So that's kind of a loaded question for anybody who's really looked at traditional Chinese medicine. It's a very complex, and we see the body as an integrated whole. So mind, body, spirit are very intricately connected, and we do not make the disconnect that happens in Western medicine. We're just not segmented. So if somebody has a headache, we don't classify it as a headache. We look at all the compounding factors that cause a certain disruption in the way that energy moves through the body, and then lump that into a pattern that we can treat. And there may be anywhere from, 12 to 15 different types of headaches, depending on what's going on in the body. So well, it's a very complex system of medicine. We can really break it down into some very simple concepts by letting you know that acupuncture in a whole, no matter where I put the needles, no matter what I'm trying to treat, it's going to decrease inflammation, increase circulation, decrease pain, and release all the endogenous hormones and chemical substances, neurotransmitters that help you feel good and happy and help counteract depression and feelings that may have you feeling pretty low. So some of those substances that you probably heard about are dopamine and serotonin. Those are two of the biggest ones. But there's also a lot of endogenous opioids. And those endogenous opioids are substances that our body already makes to help us deal with pain. So when we're doing acupuncture, we're retraining the brain to release those substances when we need them, instead of giving the body a pill and teaching the body to rely externally on a chemical reaction from a pharmaceutical to do that. So as you guys probably all know, there's a huge problem with opioids. There's a very large opioid crisis throughout the United States. And unfortunately, there are a lot of lives lost to opioid abuse all the time. And nobody starts off wanting to be an abuser of opioids. It starts off usually with people who are going into the ER, going into their doctor with back pain or some kind of chronic pain, and the physician is trying to get them out of that loop of pain. So they're prescribed these pain medications that are really only supposed to be used short term, but because there's not really a way to address that underlying pain and get rid of that issue, they end up using these medications long term. They develop a dependency, and that's where we start to see issues come in with addiction and then the mortality rates that we're seeing. So knowing that acupuncture does what it does, when we've properly spread the awareness to patients, like I'm trying to do on this site, and get the word out, but also to physicians to let them know that there's something else that we can do to address this underlying problem, and we can teach the body to manage pain in a much more effective and natural way, we can help people get out of that cycle. So kind of back to my original thought, because I went a little bit off on a tangent here. But acupuncture can be beneficial for so many different conditions because it has that effect. It brings circulation to affected area, brings inflammation down, and it releases all these good things. So in doing so, acupuncture brings your stress levels way down. And most of us, most anybody who's living in today's world, lives in this chronic state of stress. We're always chasing after something. We're always going to the next obstacle. We're always working towards something. So our bodies aren't designed to be that way. When you look back at where cavemen were, they had a stimulus that caused them stress. They got away from the stimulus and they had a chance to rest. We never get away from our stressors. We never get away from that stimulus. So we end up in this feedback loop of constantly dumping out adrenaline, constantly dumping out cortisol, and our day-to-day lives cause us to kind of be in this state of heightened awareness where we're always in this fight or flight mode, and our bodies just do not do well with that over time. So acupuncture is a mechanism for people to come in and we break that negative feedback loop. We stop cortisol from being dumped, we stop adrenaline from being dumped, and we switch over from our central nervous system to our peripheral nervous system, which is rest and digest. And in essence, we give your body a break. We give all the cells of your body a break. We give your brain a break. We kind of slow everything down. And in that process, if we can stop you from being in this heightened level of stress, we can stop the oxidative stress that occurs to your body. We can stop cellular damage. And I believe, after all the years that I've been in practice, that's why we can help so many health conditions. So we may not always be able to get to the root of the problem. We may not be able to correct something. Like if somebody has a back injury that's due to a structural problem, obviously surgery is the only fix that would go in and biomechanically fix that. But we can stop the chronic pain that they're in because we stop that stress cycle and we slow everything down. I have a pretty diverse background. I work in a hospital setting, like I shared with you, but within that hospital setting, I work in integrated oncology. So I work right in an infusion room where I'm working with my oncology patients, and I work with them on controlling neuropathy, controlling nausea, increasing their quality of life, lots of different issues in that setting. I also work in a physical medicine and rehab setting where I'm working mostly with orthopedics and pain management, and then a lot of stress issues and depression that comes along with those issues. And that really was my background before I got into acupuncture, was working in orthopedics. So I love that setting, and truly you can make such a difference for people just by seeing them a few times and breaking that pain cycle. And then lastly, I work in fertility and women's health. So a lot that we can do as far as balancing hormonal changes out, and I'm talking about young girls with PCOS, dysmenorrhea, who may be wanting to have families later on down the line, but just are not ready yet, to help them balance out their hormones and prolong their fertile years. To women that are going through menopause and really having a really hard time with that transition. Again, because we're bringing the stress levels down and giving their body a time to rest, we can help improve some of the insomnia, the hot flashes, a lot of things that are going along with menopausal symptoms, irritability, stress. A lot of those issues tend to start to go away once we deal with the stress. So in all three of those settings, I absolutely love where I am. I love my patient base, and we can make such a huge difference in people's lives because we help connect mind, body, spirit, and because we get people out of their heads, we get them out of stress, and we help them go to a place where their body can rest and recover. And acupuncture is only one piece that practitioners of traditional Chinese medicine do. It's actually a pretty small piece when you look at traditionally how we're trained. So we also deal with nutritional counseling, we deal with exercise, we deal with mind-body exercises and meditation, Tai Chi Qigong, which is our movement therapy. So many different ways that we can help people kind of get out of that constant negative feedback loop that we're in and start to make a difference in helping them take over and take back their general health. So if you know somebody in your life who's maybe thought about acupuncture, or they've had somebody mention to them that it might be a good thing, or you know that they're just struggling, please feel free to share this video. I think it explains a little bit about what we do, and then reach out to a local acupuncturist in your area, connect them so that they can start to ask questions, because truly we don't need to be so dependent on medications. We don't need to be so dependent on these external interventions when there truly is something that we can help people do to empower themselves from the inside. And the other question I get asked all the time, I'll just throw this in the video here, is does acupuncture hurt? And the answer is no, it doesn't hurt. My youngest patients are 6 months old. They tolerate the needles extremely well. The pediatric acupuncturist that I trained with actually taught us to say that we use taps instead of needles. Because when you take the connotation of needles out, acupuncture is not a scary thing at all. And if you've ever seen an acupuncture needle or a tap, you'll understand that it's truly not what our thought and what in our mind is of what a needle is going to be. So when we take that piece away, it's no longer scary. And truly, when you come to see an acupuncturist and experience acupuncture for the first time, it should feel like a little mosquito bite, or a little tiny sensation. Once they're placed, once the taps or needles are placed, you relax gently, and most people will describe a sense of feeling like they're being hugged or rocked or cradled, or they feel like they're on a boat. It's a very relaxing sensation. And that stays with you for up to 72 hours after acupuncture. So no, there is no pain with the insertion of our instruments, and you get a really great feeling to go home with. That's going to last you at least 72 hours. Then as you keep coming back for acupuncture, the treatments build on each other, and that relief starts to last longer and longer and longer as your brain starts to recognize the changes that we're making, and it starts to realize that it likes to be in this state, so it starts to do it on its own. So that's my little recap for tonight. I hope it didn't get too complex, but feel free to share. And as always, I am me. Reach out to me, get in touch. If you've got some questions, I'm happy to answer them. Thanks for listening. Bye bye.